friends, thank you so much for checking out my channel. My name is Chi-Chi, and as you can probably already tell by today's title, we are going to be discussing tips and tricks that I've picked up along the way during my time as a patient care associate in the hospital. So for context, I have 2 jobs as a PCA, and my first job I work in an adult critical care ICU, and the second I work in a med-surg telefloor. And trust me, most nights it can get pretty hectic the entire shift. That said, in my 1.5 years as a PCA, I've come across multiple tips and tricks that I've learned from others. I've kind of figured out on my own that make my job 10 times easier. So hopefully these tricks and tips, hopefully this helps you guys out, and let's get to it. So tip number 1, always keep an extra pair of shoes in your car. Hospital floors are absolutely disgusting. I'm sure if you look under a microscope at any square foot or square inch in a hospital, you will see fecal matter, all types of bacteria, blood, urine, and goodness knows what else. Those floors are not nearly as clean as you might think. In short, it's just a cesspool of germs and bacteria, and you really don't want to take that home to your family on any given day. What I do to lessen the amount of germs and bacteria that I take home with me is to wipe down my shoes with the Sani wipes that we have at my job. I wipe down the top and I wipe down the bottoms right before I leave my job. That way I can minimize all the icky stuff, especially on the bottoms of my shoes before I step into my car, and definitely before I step into my house. In addition to this, instead of just throwing my shoes in my locker or on the upholstery in my car, I actually place my shoes in a dedicated basket in my trunk. That way, I can always wipe down the plastic, again, with sanitizing wipes so it's always fresh, and whatever is still on my shoes doesn't contaminate the rest of my car, and I don't have to worry about it. By doing this, you really minimize the risk of passing something onto somebody that you really love at home. So that way, again, you can do your job and not get anyone at home sick. So second, always keep an extra uniform in your locker or in your car. You're in a hospital. We work as techs. Things are bound to happen at some point or another. Spills, patient accidents, the list goes on and on. So that said, you always want to be prepared when you're in a situation where your uniform is just completely covered in some bodily fluid or substance, and you don't want to go throughout the rest of your shift, covered in whatever it is that you have on your uniform. Trust me, you don't want to work a 12-hour shift covered in diarrhea. So do yourself a favor, be proactive, keep an extra uniform with you in your locker. So third, double gloving. Double gloving is something that I do all the time, and it saves me every single time. Double gloving is super important. If there's one tip that I think you should take away from this whole video, it's probably this. Double glove, people, double glove. I'm sure most nurses and patient care techs have a story when they were working at some point and then whoops, the glove breaks right in the middle of them changing or toileting a patient. And believe me, it's not fun. You never want to be in a situation where your glove breaks and again, you're touching different bodily fluids of a patient, because as a tech, we don't always know the full extent of a patient's history. You're not always divulged that information as to, again, anything a patient might have that's bloodborne or pathogenic, etc. Patients usually come to the hospital and they are treated for their chief complaint. That said, again, you don't know what is going on with a patient, so you just want to be extremely, extremely cautious when it comes to legitimately touching whatever it is that comes out of their bodies. So double gloving is a great way to combat any potential risk of coming into contact with poop or pee or blood or what have you. At some point, I remember I came across a research article as well that said and touted the benefits of double gloving. So if I find that, I will definitely link that on the screen here and put that in the description below so you guys can also read it and start joining in on the wonders of double gloving and realizing that it really is a lifesaver. So next, one of my biggest tips is to carry Vicks or toothpaste in your scrub pocket. This is definitely a trick I used all the time when I first started out as a PCA, and not gonna lie, I do still use it occasionally from time to time. Smells and odors in the hospital are definitely things that you have to learn to get over sooner rather than later in order to properly and effectively do your job as a tech. As a tech, you pretty much come into contact with every imaginable body fluid while you're at work, and trust me, not gonna lie, it doesn't always smell the best. When changing or toileting a patient, you never want to make them embarrassed or uncomfortable by having a look of disgust on your face because you can't handle the smell of whatever it is that you're dealing with. Because again, trust me, they don't want to be there. Nobody wants to be in the hospital. So yeah, they're probably already very embarrassed. So we don't want to add to that. To combat this, a little trick you can do is to get a little bit of Vicks or toothpaste. That's what I personally use, but I know some people might use different essential oils, a little bit of the perfume that they wear, whatever works for them. So just take a little bit of that, put that on the inside surface of the mask, the face masks that we have in the hospital, and put that on the side that goes against your face. Next, fit that across the bridge of your nose and contort that to your face, and voila! You're smelling mint or flowers or anything else that smells wonderfully. And again, that kind of masks the scent of stool or urine or vomit, whatever. So that way you can do your job, the patient is, respectfully attended to, and yeah, no one ever has to know. Always carry a pen and a dry erase marker. Those things are so important. Also, you can get those very cheaply at the dollar store. I'm pretty sure they sell like packs of like 10 for $1. Like, come on, you can't get a better deal than that. In the hospital, everybody knows when you have a pen, it always goes missing. If you leave it on your wow, 10 minutes later it's gone. If somebody asks you for a pen, guess what? You're never gonna see it again. So it behooves you to just have a stash of pens and dry erase markers that you can keep in your bag, in your locker. That way you can always have them on hand. As a PCA, you need pens because that way you can use them to fill out your report sheet for the oncoming PCA. You also need them to sometimes record vitals depending on whether or not your facility has, everything computerized, or if you guys still use like the paper documentation system. Also, you need pens, that way you can jot down any notes or to-dos for things that you want to get done during your shift and you don't want to forget. Because again, you'll be asked 10 things to do at once and you never want to forget something. So you can always make a little note, make it a little sticky, write it down. That way you can always come back to it later. Also, you need dry erase markers as a PCA because it is our job to come in and always fill out the patient communication boards. So I'm sure a lot of you guys have seen this in the hospital. So every patient in their rooms, they have a board that says the date, the name of the patient care technician, the name of the nurse, the name of the attending, etc. So it's our job to fill out the date, the name of the nurse on shift, as well as our names, as well as any current activity levels, such as whether they're out of bed, they require assistance, or they're fully independent, and if they're completely bed rest. It's the nurse's job, on the other hand, to fill out those boards with other information that she or he may have, such as medications that the patient's currently on, who the attending physician is, or any other additional doctor's orders. That said, you definitely need dry erase markers because I know depending on your unit, your nurse manager might get very angry and they might make it a point during like morning huddle, for example, to remind you guys, fill out your boards because patients, they need to know what's going on. Sometimes they're confused. There's so many people coming in on a constant basis. So that board really acts as a very vital means of communication. That way they know, again, what day it is, because when you've been in the hospital for days at a time. Sometimes you forget how long you've been there. So date's crucial. The name of the nurse and tech is crucial because, again, we're switching every 8 or 12 hours. So they're just bombarded with people constantly. So that really just helps them remember who it is that they're currently being attended by. Finally, my last trick that really helps is if you are by yourself for whatever reason, if you're busy, if you're on the floor by yourself as a tech, if none of the nurses can help you, if there are no other techs around, if you are changing a patient and for some reason it's an emergent situation and you can't have anybody who's going to be there quick enough, if you need to get them up in the bed quickly, or if you just need them, higher in the bed because they've slid all the way down, it really helps to put the bed in Trendelenburg when you're changing them or when you're attempting to reposition them. Things happen in the hospital. Things never go according to plan, and somebody who says that they'll be here in 5 minutes to help you out, hey, they can't control what needs the patient has, and they might not be there for another 10 or 20. So if you're already in the middle of assisting a patient and for whatever reason you need to get them up in the bed and you can't do it by yourself, it really helps to put the bed in Trendelenburg. That way gravity can help assist you and, save your back. You only get one. I can't stress that enough. Y'all, save your back. Put the bed in Trendelenburg. For those who may not know, Trendelenburg is a position that we put the bed in when the patient's head is facing down and then the feet are raised upward. By putting the bed in Trendelenburg while you're changing a patient, for example, gravity will do its thing, and as the patient's rolling from side to side, they're slowly inching their way up in the bed. So again, you don't have to hoist them up by yourself and again, throw something out. And you're saving your back. The patient, again, is usually very comfortable while this is happening. And yeah, it's time efficient because sometimes you can't wait for somebody else to come and help you out, unfortunately. Of course, before you do this, make sure there are no contraindications as to why a patient should not be in Trendelenburg. There are a multitude of reasons why certain patients should not be put in this position. So always, always, always double check with your nurse. For example, if a patient is just back from a cardiac cath and they have to lie flat, don't put them in Trendelenburg. If a patient is on active G-tube feeding, don't put them in Trendelenburg because you don't want them to aspirate, okay? If a patient has severe respiratory distress, don't put them in Trendelenburg because they won't be able to breathe. So those are just some examples as to why certain patients can't be put in Trend. But again, double check with your nurse. Double check with your nurse before you just start putting anybody in Trendelenburg. But generally speaking, for most patients, this is definitely a trick that helps you boost them up while you're working solo. Just had to put that disclaimer in there. So there you have it. Those are some of the tricks that I've picked up along the way as I've been a tech for the last 1.5 years. So I hope that really helps you guys. Again, this is not by any means an exhaustive list. I can definitely make a second or third part to this, but I want to keep this short, just kind of give you guys a little something to work with. But you guys let me know, are you guys techs? If you guys are, what tips and tricks have you guys learned along the way? Because trust me, I am always learning. I am always in the market to learn something new because every day has its own challenges. And if there's something that y'all know, leave that down below because a girl wants to know. Again, I'd love to hear from all of you, whether you're PCAs, CNAs in nursing homes, nursing students, registered nurses. This is a community for everybody who has a passion for the field of nursing and healthcare, as well as other aspects of healthcare, and who just want to learn more about nursing and what we do as techs and nurses. So yeah, if you like this, please leave a like for this video. I really, really appreciate it. It really helps support the growth of this channel. If you would love to, please consider subscribing. I would really appreciate it. I would love to have y'all here. It's lit on this side of YouTube, if I do say so myself. And finally, please hit that bell icon and check out the post notifications so that way you are notified every time that I post. So again, thank you guys so much for joining me for this video, and I will see you guys next time. I love you. Bye.